Well, I live in Osceola, and I was looking for a different path for this birth. My first child was born in Des Moines, and it was as close as Sheraton was to us. And so I started asking around if there were any midwives or doulas in southern Iowa, specifically, somewhere close to Osceola. And I found a resource that referred me to Sharon Squibb. And when I contacted her, I found out that I could see her in Humiston, which is really only about 20 minutes, 25 minutes from Osceola. So that worked out awesome for appointments and things. So I contacted her, started making appointments, and then we planned on delivering here at Lucas County Health Center. And I came over and toured the facility, saw this basically brand new birthing, area, and was really impressed. But also I was impressed with the nurses, and of course with Sharon and the service that I received. That would have mattered way more than the facility itself, but it was nice. It was a bonus. So my delivery day came and went, or my due date came and went, and I think about a week after that, I started having contractions, and I contacted Sharon, and she met me over here. And I just remember thinking that I was glad that I was not headed to Des Moines, where I would just be another number. And I had excellent service in Des Moines. I mean, I received everything that I needed. I had a great experience, but I wanted something a little more personal this time around. And Sharon was a provider, but also a companion to me during my pregnancy. I had one scare where I was probably a little dehydrated, and I felt like I was having contractions, and that was way too early to be having contractions. And so she helped me and walked me through that. We came in and I did a non-stress test, and anything that I needed, I could have called her for. And even if she couldn't be reached at that moment, somebody was going to give me help. Someone was going to get me in contact with her. So she met me over here the day of the delivery. I had the most excellent birth experience. It was everything that I wanted, and that was my purpose in looking for a midwife, was to do it the way that I wanted to. And that was one of the first things that Sharon said to me was, midwives basically want to cater to their patients, and she was excellent. It's so interesting in my mind to think about how different she was from our OB appointments to the day of my delivery. She was so serious, and I remember her being so much different because we had so much fun and laughed and joked and things in our appointments. But that day, it was her work. Like that was what she was here to do, was to help me through it. And she was very serious and commanded a certain presence. I know there are other OBs here, but when Sharon came in, I knew that everyone sort of respected what she was doing, and it was just a really good experience. A little bit about my birth. I came in, and my intentions were to have the most natural birth as possible. I wasn't interested in a home birth for personal reasons, but that's the type of environment that I wanted. I wanted it to be on baby's terms, as long as that was safe. And I had my husband to support me, and I didn't hire a doula. I decided that wasn't the route that I wanted to go, when I really had an excellent partner that I wanted to be that person for me. So we came in, and labor was progressing, and I walked around the halls. I got really familiar with this facility, and there's a really hot staircase somewhere along in there that we traveled up and down, up and down. We went around through the cafeteria, and then when I got to the point where I wasn't able to make jokes or walk around anymore, then they knew that I was really getting into labor. And it was getting more difficult. I was able to get up and walk around. They encouraged me to try different positions. And that was one thing that I was interested in, because I didn't want to be confined to only being able to lay on my back during labor and deliver that way. And I was interested in whatever felt the best for me. And so there was an awesome big yoga ball, and they had different chairs. They were helping me move to what felt best for me. I got up on the bed at one point all fours, and that was not comfortable. And when it all came down to it, the most comfortable thing was for me to just be laying and relaxing. And I did roll from side to side a little bit during labor, but I was so exhausted, and I didn't realize I would be so tired. But I had an awesome bath and some great nurses that helped me at the very end when I said, I can't do this. You know, when you get to that point, transition, I guess, when you say, I can't do this, I'm not going to be able to do this without any kind of pain meds. And at that point, it was too late anyway for me. So they said, you're going to have to make it through this, because we're, you know, it's going to be 10 minutes and you're going to have a baby, you know. So we transitioned from the tub at that point, in between contractions, when I thought, I don't know how I'm going to get from the tub to the bed. I don't think I can walk. Everybody was awesome, and Renee stepped in and was helping coach me through my breathing, and every contraction felt like a year and a half when I was living that moment, and now it's just a distant memory. But it was the best experience of my life. And those moments that seemed like they were going to be impossible were more manageable with the help of the people here. And I didn't even know what I was going to need, but they knew what I was going to need. And at a certain point, my husband jokes, he needed somebody else to step in and take over. And he said that, and I remember Renee being that person and stepping in and saying, okay, we're going to do this. You're going to have a baby, and we're going to count, and you're going to listen to me. And so we got back to the bed, and I delivered, and I think it was just a matter of moments before I was holding that baby. And at that point, I was really glad that I had done it, because the relief that you feel from your body going through that type of not trauma, I don't want to use the word trauma, that's the worst word, just something so serious, the relief that I felt was overwhelming. And everyone in the room, I can remember everyone in the room being so supportive. I mean, they were taking care of the baby, and Sharon was helping me, and I just remember thinking, oh my gosh, I did it. I did it exactly the way that I wanted to, and there was nothing that would have been better than that. And that made all of the hard work that I'd done in the past, it was only 3 or 4 hours for me, fortunately, but it made everything worth it. And I remember laying, just kind of waiting there, and I did hold the baby immediately after she was born, and then let them kind of take over. She was wide awake, wide-eyed, and I remember thinking that I was glad that neither of us were under the influence of any medication at all, and I could really be clear and vivid in this moment. And it's, in fact, it's strange to be back in the same room because of all the memories that go along with it. And it was the best day of our life, and I know that my husband would agree. It was something that we didn't have the knowledge to be prepared for the first time around. And if you're not knowledgeable, then you don't have options. And the thing that we wanted to do was advocate for our own birth by finding someone who was going to help us do that. And we did. And I would recommend Lucas County Health Center. I would recommend Sharon Squibb to anyone that's interested in taking a little bit of charge over their own birth. Nothing dangerous would have ever happened. She would never have allowed that. She's a medical professional. But she gave me a few more choices than I feel like I would have had I just sat back and let somebody else steer the course. And that makes it your own, and it makes it special, really special. I was not as sure then as I am now that I could do it, but I'm glad that she gave me the confidence I needed to do it, to go ahead and do it the way that I really wanted to. And I wouldn't change a single thing about what happened. And we had excellent nurses overnight. I remember dreading that hospital stay, because you just are so exhausted and you just want to be at home and take care of that little baby, and people are checking you and checking the baby. And I remember not even really minding. And I don't know if it was the kindness of the nurses or their respect for our privacy or just their helpfulness, but it was it was not a pain like I thought it would be. It was not it was kind of nice to see someone come in every once in a while. And of course you don't sleep in the first few days or nights with baby, but it was, everyone treated us as though, and we were the only OB patients in the wing, but it was like we were guests, and I knew that at any time someone was available to help me. And I don't know that we ever sent the baby to the nursery. I don't think the baby ever left me, except for maybe for a bath. But our room was attached to the nursery, so I knew exactly where baby was. It wasn't like baby went down 2 halls and around 4 corners, and I was nervous, because your instincts tell you that you want to be close to that baby, and that's what's supposed to happen. But everyone was really helpful. And another thing that was very important to me was that our nursing relationships start off really well and in a positive way. And we had an awesome nurse come in. I want to know her name. I have it on a card. I want to remember it so bad. But she came in and spoke with us and made herself completely available, made a few suggestions, but knew that I had nursed a previous child for several years. And so we had a lot of support there. And in fact, I've been able to offer her name and number to a few other people in the area that were needing help. I don't know a ton of people that are having or delivering babies in the southern Iowa area. Most of my friendships are in Des Moines, but she's an excellent resource as well. And I remember thinking that I was really glad that all the nurses supported the breastfeeding relationship from the very beginning. And I wish that I saw more of that in my experience in Des Moines, in a more metro area. And I also remember with my first delivery, and I don't want to compare everything because it's just so different, but I remember taking home a lot of formula from the hospital with me, a lot of samples, a lot of, a lot of advertising, a lot of coupons for formula, Similac and all those. And I didn't mind it because I was confident that I was going to nurse and that was going to work, and it did for me. But I can see how for a mom who isn't real confident in her nursing relationship, how that could be her moment of switch. She had the resources right there, and I know that that's so intentional. I mean, it works because that's how they get their customers. But when I left the hospital from here, and I don't know if it was because they made my bag of go home goodies specific to my needs, but I left with no formula samples, no bottles, and a magnet for my refrigerator that talked about breast milk storage, which is still on my refrigerator now, and it's been a year. But I just remember being so proud and being so happy that I could go tell my La Leche League friends in Des Moines, hey, I delivered at Lucas County and they didn't send me with formula. I got this cool magnet instead. And I was so proud that it wasn't even an issue. It wasn't even a topic of discussion. I want people to know that even though we're in southern Iowa and we're in kind of a rural area down here, there are resources, but you have to find them and you have to ask questions. And I have let everyone know, probably more than they want to know, about my awesome experience with Sharon Squibb and with the Humiston Clinic and with Lucas County Health Center, because every woman deserves to know that that's an option. I think so many people feel like their options are Des Moines or Iowa City or a big metropolitan area, big for Iowa. And there's adequate, appropriate, perfect care right here. And I would have chosen this. If it had been farther away, I still would have chosen this option because it was the most perfect thing for what we wanted. And I just want to be able to create an awareness, and I want people to know that this option is there.